I'm Kelly Mayer, licensed clinical social worker, and today I want to talk to you about what is generalized anxiety disorder, otherwise known as GAD. GAD is a mental health disorder. It's in the DSM-5, and it affects about 3% of the population. Generalized anxiety disorder is when a client, an individual, has excessive anxiety and excessive worry. Now, you might be asking, what exactly is anxiety anyway? Anxiety is apprehensive expectation. So basically, anxiety is focused on future events. The person is just very worried about something that may or may not happen in the future. And this worry is excessive. It's the type of thing that the average person might not necessarily worry quite so much about. It may be something that's very realistic that might actually happen, like a car accident, an illness, a death in the family. Those are real things that could potentially happen. But anxiety can also be about other events that are very unusual that might not really happen, such as maybe the stairs breaking and falling out from under you, the ceiling falling out from under you, maybe an earthquake, but you don't really live in a state that has earthquakes. Maybe a hurricane, but you're not in Florida. Just really any topic that, it's very unlikely to actually occur. And so that suggests that the worry is excessive because everybody worries about things, and some anxiety is perfectly normal. But for generalized anxiety disorder, the keywords is it's excessive anxiety and excessive worry. And not only that, but this has to occur most days than not about a number of events or different topics. And it also has to occur for a period of 6 months or longer. And that is part of the criteria for diagnosing generalized anxiety disorder. There are also a few other symptoms that are typical with GAD. Restlessness, feeling just keyed up, feeling on edge, being easily tired, being irritable, muscle tension, sleep disturbances, like not being able to fall asleep or waking up all night worrying about some type of topic. Also, all of this worry and anxiety, it has to interfere with the individual's life. So maybe they're getting into a lot of arguments with their spouse over their excessive worrying, arguments with friends, with family members. Maybe people have kind of stopped hanging out with this person because they're just so anxious all the time. It might be hurting their school or work performance. Maybe they can't perform their job duties because they're just so anxious, or they're getting bad grades at school because they're spending so much time worrying about things. And so as a therapist, we go ahead and we do an assessment of the client to see if they meet the criteria for generalized anxiety disorder. Because there are also other anxiety disorders that it could be, but that's my job as a therapist. When a client comes to me, is I do a in-depth assessment of their symptoms and their thoughts, and also want to know kind of what does their family feel about what's been going on, or what are their friends? Has anybody mentioned any concerns? Because that's also a really helpful factor to kind of see what other people's opinions are of the situation as well, not just solely only what the client's saying. So I do like to ask about that too. For generalized anxiety disorder, the worry is always going to be about a number of different topics. And so that's a question that I always ask my clients, is I always want to know, what are the worry topics? Because that helps determine which mental health disorder that the person has. So for generalized anxiety disorder, as you might imagine, generalized being the key word, it has to be about many different topics. So if the person is only worried about, contracting E. coli, and, they're washing their hands all the time, and they're Googling about E. coli, and they're sanitizing everything, that's not going to be GAD, because if that's the only topic, it's not generalized. So for GAD, we need many topics. So a lot of times the client might come to me, and when I ask what they worry about, they will say, I worry about everything. So they're going to have big worries and also small worries. That's another hallmark of GAD. So for big worries, those would be, of course, similar things like, death, illness, bankruptcy, losing your job, your child getting sick, being in the hospital, those types of things. Getting in a car accident is another really big one. But then there also has to be small worries. And the small worries, even though they're small, they're very difficult for people with GAD, and they really interfere with their life. So some very common examples of small worries might be things like worrying about offending somebody in social situations. They may just pay a lot of attention to what they say, how other people are going to perceive them, if other people like them. And although those are common things that most people worry about, for GAD, it's excessive. So they may be spending, an hour or more a day replaying a conversation they had earlier and just worrying about how it went. When in reality, it's really not that big of a deal. A particular conversation with just some random person at the store isn't really that important. So again, the keyword being excessive worry. Another small thing that is very difficult for individuals with GAD is they have a really hard time with making decisions quite often. And this may be small things like going to a grocery store and having to decide what kind of soup to purchase or what kind of soap to purchase. For most people, these would be small decisions that they might just spend a minute on, just kind of reviewing and selecting. But for individuals with GAD, this is very difficult for them. They may spend a very excessive amount of time researching reviews on different types of soup and reading all of the labels and the ingredients, and they're very worried about making the wrong choice. And so just these simple decisions, you can see how that would really interfere with somebody's life because it's so time consuming. If they're spending that much time making these decisions, maybe they have to purchase things for their house and they're deciding between, a pink pillow or a blue pillow. That might be very difficult for them to make a decision. Going out to eat at restaurants, it's very difficult for them to decide which restaurant to go to because they're afraid of making the wrong choice. If they're going with somebody, they may be worried that person's going to have a bad opinion of them if they select the wrong restaurant. They may be worried about interactions with the staff at the restaurant if they are making a good impression, if they're being rude. It might be very difficult for them just to speak up about basic things. Maybe they need a straw or maybe they need ketchup at the restaurant, but it's actually very difficult for them just to speak up to the waiter to go ahead and say these things. So it's a lot of very small things that kind of pile up and can really make life very difficult for somebody with GAD because it can really interfere with relationships because they're spending so much time worrying. Another thing that's very common with individuals with GAD is what's called a worry chain. So a worry chain is when somebody will begin to worry excessively and it will jump from one topic to the next, to the next, to the next. So maybe it starts off with they're worried that they made a mistake at work, which again, GAD, it's a lot of the worries are very normal. It's just the person has very excessive time consuming rumination and worrying. So maybe they're at work, they're worried about making some type of small mistake. So instead of just stopping there, they engage in what's known as a worry chain. In the worry chain, it's going to jump to different topics. So it might start off, I'm worried I made this mistake at work. I'm worried that maybe I made a mistake last week. And I also made a mistake a year ago. And I'm also worried, what does my boss think of me? Because I keep making these mistakes. And does my boss think that I'm a bad employee? And then am I going to get fired? And if I get fired, how am I going to react to that? Am I going to be able to cope with being fired? And not only that, but what is my spouse going to say when I get fired? And are they going to divorce me because they're so angry? And if I lose my job, how will we pay for things? And will we go bankrupt? And will we lose the car? And if we do lose the car, then how will we go about buying a new car? And if we bought a new car, what type of car would we even choose? And so as you can see from this example, that is actually a very typical worry chain for someone with GAD, where you can see how it jumps from one topic to the next to the next. And in the end, you end up with something that's actually completely unrelated to the beginning of the worry chain. So when I do therapy with clients who have GAD, That's one key thing that we always do in sessions is we always talk about worry chains, because I want to hear about their worry chains. That's probably the most helpful tool, is when I have clients write out their worry chains and I can start to analyze them, because I really want to know what are the different topics. And then once we know that, and once I can do an assessment of their symptoms and see how this is specifically interfering with their social, emotional, educational, occupational functioning, once we do all that, typically what we'll do is we will use cognitive behavioral therapy. For cognitive behavioral therapy, we examine the anxious thoughts and we begin to challenge them. And that's something that's very difficult for people with GAD. Because if this were easy and if they could just do it all on their own, they wouldn't be in therapy. The reason they're here in therapy is because they can't figure out how to stop worrying. And it's just interfering so much with their life. So what I like to do to help these clients is I like to ask them questions to try to challenge these anxious thoughts. And we talk about things like, is this a realistic worry or is it not realistic? What's the likelihood that this is actually going to happen? And also comparing these worries to just other people who don't have GAD can also be very helpful. So we talk about, somebody else in the same situation who didn't have GAD. How do you think that they would react? And how do you think they would perceive this same situation? So I do a number of different types of cognitive behavioral techniques to just talk to the individual, and I teach them how we can go about challenging these anxious thoughts, and also what are some really good questions that they can ask themselves to challenge the anxious self-talk. And so mostly cognitive behavioral therapy, is very effective for GAD. Another thing that is very helpful is we talk about intolerance of uncertainty. So the key for individuals with GAD is they are not tolerant of uncertainty. And that's really the key that we discuss in therapy. People have different levels of tolerance to uncertainty, but if you cannot handle any uncertainty in your life, it's going to cause a lot of distress in your life. And the only way to really work on that is to become more tolerant of uncertainty. And so with that, I do a bit of exposure and response prevention therapy to try to challenge the client to engage in some situations that are uncertain. So this might be just, when they go to the grocery store, maybe they have a challenge of, they have to set a timer for 30 seconds and just grab a bottle of soap, and they have to just walk out, and they're not allowed to go back and change their decision. Homework assignments like that are actually very challenging for people with GAD. That would be a situation that would be very difficult for a new client to do. But those are the types of things. I always like to challenge my clients when they're ready, when they feel ready. I don't push them too far, but I do like to give them a little nudge here or there because that's my job as their therapist. And so we basically just discuss all these worries, challenge all these worries, and then after that, challenge them to actually engage in behaviors that are hard for them. Because most people with GAD, they cope by using avoidance. And so they avoid these situations that are anxiety provoking. And that's what fuels the anxiety. And so in therapy, I encourage my clients and I collaborate and I work with them very slowly over time because they have to get to a point where they do trust me as their therapist. But I do challenge my clients to go ahead and do these uncomfortable things because I want them to get better. And so that's really an overview of generalized anxiety disorder and a bit about treatment of generalized anxiety disorder. And so if that sounds a little bit about like what you're experiencing or what maybe a loved one is experiencing, I would really encourage if you're in Florida, feel free to reach out to me. If you're in another state, go ahead and look for a therapist in another state. Psychology Today is a very good online directory, and it has many different therapists, and you can put what your symptoms are. Like you can select anxiety or generalized anxiety disorder. You can go ahead and select you want somebody who's going to do cognitive behavioral therapy, also known as CBT, and you can go ahead and put in where you're located, and you can do a search, and you can go ahead and find a therapist that would be convenient for you, so that you can go ahead and get treatment, and most importantly, you can go ahead and overcome these symptoms and just be able to cope better with your life, because GAD, it definitely is a very difficult disorder and really causes so much distress for the people who unfortunately have it. But there's hope that with therapy, I've had many clients with GAD, and I've had many clients that were very successful as long as they stick with therapy and they meet with me regularly. I've had many clients that ended up discharging from therapy because they really felt that they were better. And they'll always have some anxiety, but the key is to get your anxiety to where it's a manageable level. That's what I always tell my clients. We want to go ahead and teach you coping mechanisms so that you can deal with this anxiety and that you can go ahead and still be successful in your life, and just do your educational, your vocational goals, be able to function with your family. If you're married, be a good spouse. If you're a parent, to be a good parent. Whatever it may be, whatever their roles are, we really want them just to be successful and be able to overcome the GAD.